we are going to discuss about subclinical hypothyroidism in children. Hypothyroidism develops when the thyroid gland is underactive, and we call subclinical hypothyroidism when the TSH is above the normal range but the free T4 hormone is in the normal range. Subclinical hypothyroidism can be mild, that is TSH between 4.5 to 10, and it can be severe when the TSH is above 10. The causes of subclinical hypothyroidism in children are, the most common causes, Hashimoto's thyroiditis or autoimmune hypothyroid. Other causes are, it can be idiopathic, it can be due to radiation in the neck due to pediatric cancer, it can be due to genetic syndromes like Turner syndrome or Down syndrome. It can also be found in obesity, iron deficiency anemia, and nephrotic syndrome. So, when a subclinical hypothyroid child comes to us, what should be our approach? Our first approach should be a proper clinical history, where we should inquire about the birth history, history of radiation, developmental history, also history of other autoimmune disorders in the family, or history of genetic syndromes like Down syndrome Turner, or history of enzyme defects leading to hypothyroidism in the family. In the clinical examination, we should look for the growth parameters in the child, that is the child's weight, the child's height, whether it's appropriate for the chronological age, the height velocity, the bone age. Also, we need to see for any evidence of goiter in the child. We also need to see whether the child is having signs of frank hypothyroidism. And regarding investigation, apart from the routine investigations like complete blood count, liver function, and we should also check the lipids in the child, as well as we need to do a dedicated thyroid test including the TSH and the free T4 hormone. And if the TSH is elevated, we also need to do a thyroid autoantibody panel, which includes the thyroid anti-thyroid peroxidase antibody, anti-TPO, as well as the anti-thyroglobulin antibody. And we can also do a thyroid ultrasound to look for hypoechoic pattern or thyroid nodule if present. And do all subclinical hypothyroid children need treatment? No, all of them don't need. If the child is having a TSH above 10, irrespective of the clinical symptoms, the child needs treatment. And if the TSH is between 4.5 to 10, an individualized decision should be taken based on the clinical symptoms of the patient, the patient's growth chart, and also the patient is having a family history, and if the patient is also having autoantibody positive. Subclinical hypothyroidism, if present and there are definite clinical indications for treatment, should be treated in a child to achieve best possible outcomes in the child. Thank you.